I appreciate the opportunity to be with you today, and I'm sorry I can't be with you in person. But I want to talk a little bit about breaking the partisan gridlock, something I'm working at daily down here, and also some of the healthcare policy issues that we're dealing with. It's a great pleasure to be involved with the Hanley Center. I think I spoke at one of the very first dinners of the organization when it was set up, and I understand now there's something like 200 alumni around the state, and that's who's gathered at Maple Hill Farm. I'm sure Scott Calger's taking good care of you, and Jim Harner is, I know, leading the organization, old friends from my days in Brunswick and in Augusta. Let me just share a few thoughts on trying to get people to work together. It's very difficult, and there are all kinds of reasons. It has to do with money in politics. It has to do with history. It has to do with recriminations for past offenses. But I do see a few, I'd call them tender green shoots of bipartisan action down here. One is, of course, the work that's been going on for the past 6 weeks or so on immigration reform, where we've got 4 senators, 4 Democrats, 4 Republicans, having some very serious talks, and my understanding is, as of this week, they've reached some pretty firm conclusions about where they want to go, and that's something that just wouldn't have happened 2 or 3 years ago. So that's a positive sign. Another one is the passage of the Violence Against Women Act, which languished here in the Congress for the last 2 or 3 years, passed in the Senate this winter, went over to the House. There was some belief that the House was going to pass a different version, and we'd be in a conference, and it would end up falling through, languishing again for another year or so. But in the end, the House passed the Senate version, went straight to the President, and has been signed. So it's very easy to focus on the filibusters and the conflict and those kinds of things, but there are a few places where there is some bipartisan activity going on. The other thing I'm sure you've noticed is the President's outreach to Republicans over the last several weeks, which I think is a terrific idea. It's something, I think it's a very positive development. Even though the Republicans may not like him very much, he's an impressive guy, and some of the feedback from the dinner last week was, wow, this guy's really smart, and he really thinks about these things, and he doesn't have horns, and I think that can only be positive, and I think the President hopefully is going to continue those kinds of activities. He came this week to the Democratic caucus lunch. I believe he's also going to the Republican caucus lunch. Stayed for almost 2 hours, answered a lot of questions, and I think this is going to make a difference. I certainly hope so. The issues that we're having the hardest time with, though, are the fiscal ones, are the financial ones, the budget ones, and that's really, in my analysis, because solving this budget crisis really goes to the core values of the two parties. On the one hand, the Republicans want to talk about entitlement reform, which the Democrats absolutely don't want to touch. On the other hand, the Democrats want to talk about additional revenues from tax reform or increased taxes on high-income individuals, which the Republicans want nothing to do with. And that's why it's hard to get agreement on that. And I think it's no accident that we're seeing progress on issues like immigration, where we're still pretty much at a standstill on the fiscal issues. The other thing you should be aware of, and this is just my analysis, but I think one of the other things that's pulling the parties apart here in Washington, particularly on these fiscal issues, is a fundamental disagreement about the role of government. The Republicans, by and large, and this is a lot of the influence of the Tea Party, are very much in favor of smaller government, more limited government, and you don't know exactly what that means, but basically smaller government, more individual rights, and that point of view. The Democrats, on the other hand, have a point of view that the government can be a force for good, that it's important in our society to protect the most vulnerable and to provide programs and support which give people access to the middle class and upward mobility in our society. So those are really fundamental beliefs that are even deeper than the issues of taxation or entitlement reform. And so that's why some of these issues are very hard. The other positive news I can report is that on a personal level, I have found the atmosphere here less poisonous and less partisan than I expected. Yes, there are differences. Yes, there are filibusters. Yes, there are irritants, and there certainly will be more. But on a personal level, people do want to talk to one another. They do want to try to find solutions, and seem to be looking for opportunities to work together. So I think that's a very positive development. Now, you know, what's my role in all of this? I'm trying to act as a kind of bridge. I'm trying to do a little shuttle diplomacy, if you remember Henry Kissinger from the 70s and 80s, trying to talk to both sides, to find areas of common ground, to nudge people toward agreement. We're going to be working on the budget this week, and I'm not sure how much agreement we're going to be able to get, but I'm still trying to find ways that we can work together, and hopefully as time goes on and I establish myself on the committees that I work on, I'll be able to play that role. Let me change the subject a minute, though, because having a group of distinguished health professionals like yourselves all in one place at one time in Maine is an opportunity I don't want to allow to pass up. You should understand that at the heart of the federal government's budget problem is the cost of health care. It surprises most people to learn that what we all think of as the federal government of typical functions, the national parks, the highways, the Veterans Administration, the federal aviation, those kinds of federal functions, the so-called non-defense discretionary funding, is at the lowest level as a percentage of gross domestic product in the last 50 years. The idea that federal government spending is exploding when you're talking about those functions just isn't so. The other thing is that defense is not at the lowest in 50 years, but it's at a level that it's been at historically, and it can be sustained. There certainly are areas to cut. There are areas to cut in all areas of government, but it's not, again, it's not exploding as a percentage of GDP, which is the real sort of apples to apples way to measure this. However, the projections of the deficit that are scaring everybody are almost entirely based upon projected growth in health care costs to the government. Medicare, Medicaid, federal employee pension and health care expenses. And just to put it in perspective for you, the projection I saw, and I can't remember whether it was 20 years or 25 years, has health care expenditures by the federal government growing from 4% of GDP to 12% over that period. Now, to put that in perspective, defense is about 4%, between 4 and 5%. So you're talking about essentially tripling the defense budget, in effect, because of the increases in cost of health care. Now, some people say, well, that means we got to cut Medicare, that's what's killing us, those are where the expenses are. I don't believe that's true. I think what we have to do is talk about controlling the costs of health care generally, which in turn would benefit Medicare and Medicaid, and it would also benefit all the citizens of our society. And in that direction, I think there's some very hopeful things happening. All of you know, I suspect, about the accountable care organizations that are now being developed in Maine. I believe there are at least 3 in the Portland area, Augusta area, and Bangor area. There may be others and I haven't heard about. But I think that's the direction that we have to go in order to provide the right incentives to keep people well, instead of simply providing reimbursement for when they're sick or when they need a procedure. You all know, for example, the cost to Medicare of diabetes is enormous. And diabetes is a disease that can be managed, and if successfully managed, the cost of treating it can be driven down very substantially. So I urge you, as you're talking about leadership in healthcare, to be thinking about different ways, and believe me, I'm not a big regulation guy. I don't think we should be trying to deal with this by regulation or cost controls or those kinds of things. I think we need to think of structural ways that we can change the way the system works, particularly in terms of how payment is made, and move away from fee-for-service toward some kind of global budgeting, capitation, I don't know what you want to call it, but that provides incentives for prevention and for primary care so that we can at least slow down the growth of health care costs. And by the way, there is some good news on that front too. The Congressional Budget Office just projected a $500 billion savings over the next 10 years because of a slowing of the growth of health care that has taken place over the last couple of years. Nobody really knows exactly why that's happened, but the dollars are there, and that's a good sign. So, but that's the direction that we have to move in, and you all as healthcare professionals are in the best position to help us figure this out. 10 or 12 years ago, I visited a Toyota plant in Tokyo, Japan. And in that plant, they made one RAV4 every minute. A new RAV4 came off the line every minute. And I asked them how they did it, how they'd become so efficient in manufacturing. And the fellow said, last year we had 14,000 suggestions from our employees about how to do this better and make better cars more efficiently and less expensively. And we listened to them, and we implemented thousands of them. You're the frontline people in healthcare. You know where the savings can be had. You know how the structure can be changed in order to improve delivery and outcomes and value for all Americans and particularly all of our friends and neighbors and family in Maine. So I commend you for the work that you're doing, and I can tell you that you're in the right place at the right time. If ever there was an area of American life where leadership was important, it's in this area of healthcare. And I know that you're thinking about it and talking about these things. I'll tell you what, I'll keep working on the partisan gridlock down here. You keep working on how to deliver higher quality health care at a lower cost to the citizens of Maine, and we'll check in with each other from time to time, and maybe we can together make some progress on these important issues. Thank you so much for what you're doing. Thank you for your creativity. Maine has so much to be proud of in terms of our medical system and the value we deliver, and it's a tribute to you and your colleagues across the medical community in Maine. So thanks very much, and I'll look forward to seeing you, many of you personally, on weekends and during recesses and this summer, and keep up the great work. Thanks a lot, and good afternoon.